Hi everybody, my name is Liz Clayton. I'm one of the staff nurses with the school nursing team in Warsaw. Today I'm going to deliver the toilet training for school age children to yourselves. So, welcome to the school nursing service. School nurses are qualified nurses who have additional training in child health and wellbeing. They work within a team with staff nurses, nursery nurses, support workers and administration staff. The school nursing team support children and young people from reception up to the age of their 19th birthday. We work with young people also who have disabilities or additional needs, and they can access our service up to the age of 25 years. The team provides support and help with a range of physical and mental health problems. So, how can you access our service? We operate a single point of access. We work Monday to Friday, 9 till 5. Our contact details are here. The landline number there, the 01922, and then we've also got a text service. And the number is there. We offer confidential advice and support. And our text service allows parents and carers to contact us anonymously. So if you do send us a text in, obviously that will come along anonymously, and then we can answer you back and maybe ask you to give us a call, or we can just talk through the text. So what is toilet training? So toilet training involves learning to understand the actions, language and routines involved in learning to use the toilet, developing skills and independence in managing these skills. So why is toilet training so important? Every child should be supported to reach their full potential. Learning to use the toilet is one of the most important skills that a child can learn. The development of the skill has a large impact on the child, young person, their family, friends and professionals that work with them. Persevering with toilet training programs encourages independence and can promote dignity, being confident and reduces vulnerability. So toilet training children with additional needs may be challenging and can feel a bit daunting at times, but persevering with this can help, because every child should be supported to reach their full potential regardless of their age, culture or ability. Developing skills needed for toilet training will have a significant benefit on your child's self-esteem, relationship with others and future opportunities. Sometimes it can be easy to think to cheat your child in pads rather than persevering with a toilet training programme, but it's not helpful in the long term. Persevering with toilet training will in time reduce the stress of changing and cleaning your child, having to find a place to change them and the financial cost associated with incontinence. As I've said previously, being continent reduces vulnerability also. Children who are incontinent are dependent on others to meet their toileting needs. Therefore, many people may be involved in their personal care. Incontinence, therefore, places them at more risk of abuse. So, timing of toilet training. So just because your child has a physical or learning disability, it does not necessarily mean that they cannot be toilet trained. So do not wait for your child to show signs that they are ready. Some will never do that, but that doesn't mean that they can't be toilet trained. You might have to ask them to come to be asked to come to the workshop today following a continence assessment, where it may be done by a nurse that your child is showing some signs that they could be toilet trained. Don't postpone toilet training until they're older. It may be easy to postpone it, but is it always best? However, not to postpone toilet training for too long, as your child will learn that nappies are a portable toilet and will learn that's what they do when they need to wee and poo. They just use the nappy that they've got on. So some children with additional needs, particularly ASD, may get upset with changes in routine. Toilet training will involve many different challenges, so it's helpful to look at what other changes are happening at that time, such as a new class, new changes in the family, new child, new house. Changes of staff at school are affecting them, but when they're thinking about the toilet training, so try and think of a time when there's not a lot of changes happening and we can concentrate just on the toilet training. Make sure it's a consistent approach. It's important that everybody who cares for the child know that you're beginning that program and that you're all going to follow the same regime and follow the same plan for the implementation of the toileting. So, getting ready. So, the first stage is all about learning new skills and routines. The first stage is all about really getting ready. This process can take a long time, and only small changes might be noted initially, but it may require you to think out of the box and think about your child and their needs individually. And that's what I'm saying. It can take a long time just to get to the first stage, but just be prepared that it can be a lengthy process. Each stage might take different times, and we might fly through the first stage, and then the second stage takes a lot longer. So, make the toilet a positive and enjoyable place. So, important you consider all the things that might make the toilet a challenging place for your child. Look at the lighting in the room. Look at the sounds, look at the smells in there. Some cleaning fluids are very, very strong in their smell, and it might be that they don't like that. How the things change in there when the toilet flushes. If they don't like going into the toilet, think about small steps and encouraging them to just walk in there every couple of hours throughout the day. Gradually increasing the time spent in there as much as they can tolerate it. So changing them in the toilet or in the bathroom. So completing nappy changes in the bathroom allows your child to start making the link that this is where I go when I have a wee, this is the room that I go when I need to have a poo. So they associate the toilet with that happening. If they're reluctant to go into the actual bathroom, then just try and, if we change them on a mat, then just trying to edge the mat a little bit closer towards the bathroom. So we start to make those links between the bathroom and going to the toilet. So reinforce, changing them standing up when possible. Again, telling them they're wet when they need to be changed, reinforcing that they're dry. So, we're putting the nappy on, that's it, you're dry now. But when we're changing them, letting them understand that that's the time when they are wet. Try to avoid using negative language associated with toileting. And what we've all done this in the past, I'm sure. But poor, that stinks. Change your smelly bum. This just isn't going to increase their disgust really, and we don't want to increase any anxiety about going to the toilet any more than what they've already got. So I think talking to your child is vital about what the toilet's for, what happens, showing picture cards or timelines can help in the children with additional needs to understand. And children who've got communication difficulties, pictures, timelines, anything that will show them the process from going into the bathroom, using the toilet, washing our hands, flushing. And coming back to washing hands is one of the most important physical skills that we can reinforce to a child and learn them with toileting. But it can also be quite a fun thing for a child to do. So bringing in the fun, but also reinforcing the importance of them actually doing it. So, next slide that we're going to talk about is developing physical skills. So this stage is about developing some of the skills that are required to actually use the toilet. So let's have a look first to see if your child needs any supports or aids that might be needed or might help them to actually use the toilet. So we could think, what do they need? Is it something to help them get onto the toilet, something to help them get off, something to make it more comfortable when they're sitting on there? If this is, then you can speak to a member of the school nursing team. If your child's got a disability, they might need some aids, and we can make a referral on to occupational therapy, and these services will help you and they'll provide the supports that you need for it to be more of a supportive process for your child, so that, there might be some portable continence aids that we can give to you. If they've got mobility issues and finds getting out of the bed difficult or wheelchair difficult, then, they might need more help with the continence pads. This is something that we can support you with and make referrals onto other services. So one of the first things is encourage your child to sit on the toilet with the seat down. Sometimes this can happen just to clean their teeth, wash their face, just getting them into the toilet and even near the toilet. and understanding, yes, we want them to recognise that we go to the toilet to what we do, but just getting them the confidence of actually going into the bathroom and sitting on the toilet. And then we can progress onwards to sitting on the toilet for a very short period of time. A small bag of toys containing little books or a toy might help them to sit a little bit longer. Pictures them, again, coming back to the picture cards that I've spoke about previously, just might help them to process this clearer for the children with communication difficulties. So just breaking it down into a process from, recognising that we need the toilet, walking into the bathroom, taking our clothes down, sitting, getting off the toilet, putting clothes, or washing our hands. So it's just breaking it down into a process that they can understand. Encouraging your child to pull up and pull down their own clothes and become involved with the whole process. And these are important self-care skills, which are all needed to gain to help them to promote their independence and dignity. Some children might find flushing the toilet quite frightening, and it's sometimes not till we stand back and listen to the noise that the actual toilet makes that we realise how frightening it might be. Using the mat or the rug outside of the toilet area and flushing the toilet outside. So we could sit outside the toilet with and flush it, and then gradually move ourselves in towards it and showing them that nothing's going to happen, explaining what's happening. Providing a flashcard or a symbol to communicate with the child to show what's going to happen. This is what's going to happen. We're going to flush the toilet. This is where we're going to go. We could be saying ready, steady, go. Make it a pleasant activity at the same time. And don't flush the toilet until your child's completely finished the toileting routine, including washing their hands. Try to encourage your child to stay in control and make that part of the routine. Let them flush the toilet themselves. Some children will overflush the toilet, and that might need to be reinforced with the visual symbols that we only need to flush it once. So we could have a yes and a no, where they turn it over so they know that they've done it. So we could have flushed, yes, flush, no. You'll get, obviously it'll all be generated around your own child, so you'll know what they want to do. And then throw in solid waste from nappies and pull-ups down the toilet and encouraging your child to flush it away. So if you have got a child that's extremely anxious about going onto the toilet, doesn't want to go there, will only poo into the nappy, if that is for the first stage, we could actually take the nappy to the toilet, empty the poo into the toilet and show them what's going to happen. Show them we press this button and it goes away. Try and alleviate that anxiety around having the poo on the actual toilet. Encouraging your child to wash their hands. Some children play with the water in the toilet because it's a toilet, it's like a sink, but trying to keep the toilet covered until it's time to use it. So try and keep the seat down. We could get some little distractions like glitter tubes that we've used in the past. Provide your child an opportunity with the play with the water as they wash their hands immediately after using the toilet, but making them realise that they must go to the sink. It's not the water in the toilet that we're going to use. Developing the skills required for toilet training can take a long time, as I've said previously, and we might only make very small changes in the progress made. But I think just recognising those very small ones and praising them. And as I said, each stage might take a very long time. But it's important that you persevere and think about the small ones of these skills. And any small, any progress that they make is a massive, massive achievement. So it's important that we recognise those and praise them. So, raising awareness. So this is the stage where we look at identifying your child's toileting habits. So first one, trying to work out how long your child can stay dry for. One of the things that we have done in the past is place some folded kitchen paper into your child's nappy or pull-up at the first change of the day. So they get up in the morning, we change that wet nappy or that pull-up from overnight and we put a clean nappy on or a clean pull-up. We fold some kitchen roll and just put it at the front so we know that when it's wet. And we check this hourly and record if it's wet or dry. or if it becomes soiled, then we'll change it and put a clean one totally in there. But if your child can stay dry for an hour and a half, then we can be looking towards taking the nappies or the pull-ups off. Okay, so it's just a matter of monitoring it for a few hours and seeing how they get on, and every hour going back to it, see if it's wet. So knowing what time they have a poo is also a good thing. And it means that you can encourage them to go and sit on the toilet at that time. So try and monitor it for a few days prior to that. Recognise the time. Is it between 9, I don't know, say 8 and 8:30, or is it 9? Or is it between 5 and 6 of an evening? Try and recognise that times. Look out for non-verbal signs as well as verbal. If your child is non-verbal, it might be that they go off and hide somewhere. It might be a different noise that they might. Try and recognise those noises or the situations that they take themselves off to, and recognise the times, and then we can encourage them to sit on the toilet during those times. Children communicate in so many different ways. They might go over and point at the nappies, they might point at their pull-ups, they might go into their bedroom or into another room to do a poo. And that's what I said to you, they might go off and hide somewhere that they feel comfortable. Then need to be able to communicate so they can use the toilet. So visual symbols or picture cards can be used with help this. We've worked with children in the past where they can just go to the card and point, or they can have the cards around their neck and they can show you. So however best works for your child. So I'm working out roughly what time you're thinking that they need a wee or poo will help you gauge how many times they need to go to the toilet. So if they were dry the first 2 hours with the toilet, the kitchen roll there, after about an hour and 40 minutes, maybe try them at the toilet and sit with them and try, because obviously we know that they've got the capacity in the bladder to hold it for that long. Look, as I say, just recognising symptoms, do they make grunting noises, like we've said on the slide here, or they're making a noise, or they've gone hide in another room, to realise that they need to go and open the bowels. So actually using the toilet. So this is actually the stage that your child is expected to use the toilet. So at this stage, they should be happy to cooperate. So they're happy to go into the bathroom, they're happy to sit on the toilet, they're helping to pull up their clothes and pull them down, they're happy to use the hand, happy to wash their hands, and they're happy to flush the toilet after they've used it. Explaining that all wee and poo is going into the toilet and we're not going to have any nappies on in that day. So start the day off, right, today, this is the day, we're not going to have any nappies on, we're going to put pants on and we're going to try, this is what we're going to do, we're going to use the toilet as much as what we can. Explaining to the child exactly what's going to happen. So taking them to the toilet every 1 to 1.5 hours. The visual cards will help to communicate what is happening. We could even use a social story if we wanted to, telling them it's time for the toilet. Don't ask them, don't say, right, do you need to go for a wee? Because we might not quite understand what's going on there. So, right, we're going to the toilet. Don't ask them if they want to use the toilet. Incorporating going to the toilet as part of your child's daily routine. Encourage the bathroom to be a calm, relaxing environment. Do we need to use some music maybe if they want that? Favourite calm toys, soothing light, screen off, no iPad in there, or even putting a screen across the bathroom if we need to, so that if they feel more comfortable with not being able to see the sink or the bath, whatever works best for them. Keeping records, as I spoke about before. Keeping a record of the time that your child is wet or the times that they go for a poo in the toilet and in their underwear. Use this information to try and gauge how often if we need to change the toileting routine or the timings. If we just get to them to say we're going to the toilet and they're wet, maybe we need to go maybe just over 1 hour. Just look so we can gauge the times that we need to take them to the bathroom. It may be that your child will never communicate when they need to go to the toilet, so timing is the only opportunity that we can get to get them to be toilet trained. So it's about recognising the times, signals, anything else that they do. If your child, and many children will, become distressed at this stage, it's fine to return back That's fine. Please don't worry. Let's go back to a previous stage and develop those. Sometimes we might think that they're ready to use the toilet and they're not. So let's just step back a stage and get that one perfected before we move on to this. So, developing good toileting routines. The most important way to ensure that we've got a healthy bladder and bowel is to ensure that we have enough fluids each day. As you can see here on the presentation, what we've done is that we've broke it down into age groups. As you can see, for boys and for girls, and you can see in front of you how this is what we should be aiming towards. Drinking well is so important. Children need their bladder to be at least half full before they can actually feel like they need a wee. It's therefore important that they're taking in enough fluid into their bladders to be used effectively. So drinking the recommended fluid will also help prevent against constipation also. So good toileting routines. Ensuring your child is correctly positioned on the toilet. So as you can see, this Roman man here, a good position on the toilet is knees higher than the hips, leaning slightly forward with your elbows on your knees. So the gastrocolic reflux response, which is activated when the stomach is stretched, causes contraction in the intestine to give you the urge to have a bowel movement. So what this basically means, 15 to 20 minutes after eating a meal is the perfect opportunity for your child to sit on the toilet and try to open their bowels. You could put a bag in the bathroom, toilet, anything, whatever they're sitting, put it by them or behind the toilet, wherever they feel is best comfortable. And it could contain little certain activities that they can do while sitting on the toilet. What research has shown is that the muscles that we use to blow bubbles are the same muscles that we use when we're having a poo. So we could have anything that involves blowing. So it could be that we could hold a straw and blow into the straw, or we could do some bubbles, but that's not always great in the bathroom if you've got a tiled floor. So even the stick that we hold for the bubbles, we can just get them to hold in the hand and pretend to blow. A balloon maybe, anything that's going to involve those muscles, we try. That would be great to have in their bag by them. Ensuring regular toileting after the meals, just reinforcing about 15 to 20 minutes is the optimum time that we may feel that we need to go and open our bowels. Encouraging them to sit for short periods, and this is where the toys or the little activities come in. So a lot of children will just sit on the toilet and then I'm finished, I'm gone. But ensuring them to sit there comfortably, making the room relaxed so that they feel calm. And if they are calm, then hopefully they will have the bowels open. The blowing exercises when sitting on the toilet, try and get them to lean forward like the statue here and blow. Again, that's the optimum position. And the blowing will only encourage the muscles to be used to open their bowels. So, making sure your child is not constipated. I'm sure a lot of you will have seen this before. This is what we call the poo chart. If you've been to see one of the school nurses, you may well have been shown this when you came for your assessment. What we say is that your child should pass soft stools at least 4 times a week. If they're passing fewer than this, or the poos are hard, they may well quite be constipated. Leaky, runny poos can also mean they are constipated. Other signs that the child might be constipated include passing large stools. Large stools, I mean that they almost look like they might block the toilet. Passing offensive, smelly wind. Some soiling on their underwear. And they've got no idea why this is happening. So they might come home from school and you notice that there's some soiling. Soiling is where we're getting poo stains onto the bottom of the pants. So there might be some, and this is where the poo is trying to come out of the bowel and it's actually marking their pants. It can be sticky, it can be offensive smelling, and it can be runny. So if your child's got any of these signs, then it's vital that you go to the GP and ask for further assessments and treatment of constipation. And before starting toileting routines, if you think that your child is constipated, it's really important that you do go to the GP and we get that worked out before we start to look at toileting routines. The ideal, if we look at number 4, this is what we're looking for the poo to be like. So this, if you'd come for an assessment, this is what, and type 1, 2 or 3, we would say show signs of constipation. Definitely 1, 2 and 3 are all signs of constipation, but the optimum one that we're looking at is 4. So good toileting routines continued. Important that we're having a good, well-balanced diet. Regular meal times and drinks, as I've spoken about before. Once we've eaten, our food travels down our intestines. It's almost like a conveyor belt. If we think when we've been to the supermarket, we put our shopping on and it moves along. If we eat food, that moves along our intestines, all inside and goes down. So we need to move that on a regular basis. So it's important that we eat our fruit, our vegetables, and we drink lots of fluid. Often children that are constipated don't drink enough fluid and the poo is actually drying out within the bowel. So drinking is just as important as eating. So some common toileting problems that we have spoke about with parents that we worked with before. Some children will smear faeces onto the walls, so they will smear the poo once they've passed it. Some of the ideas that we worked with parents is about using a visual timetable that I've used before. So breaking down the toileting process into a routine. When we've been to the toilet, we wipe ourselves, we pull ourselves up, we wash our hands and we flush. So breaking it down into a process that they can understand and that they can follow. Is it better to use toilet paper or is it better to use wipes? Again, this is specific to your child and what's best will work for you. Supervision, if this is happening, do we need to have constant supervision when they are going to the toilet? Recognising when they're doing it. Are they doing it because they're bored or are they doing it because they like the feel of the poo? So recognising the supervision if it's needed. Giving them something to do with their hands. So again, the bag that we've spoken about before made it like some children have used fidget spinners, some like to use the, some shops actually do like a water hand thing that we can, and it feels like the poo, so that they can use that when they're actually on the toilet. Providing alternative sensory activities. So some children might like the feeling of the poo, they might like it, it's warm, it's something that's come away from them, so they feel like it's part of them. So sometimes we've used Play-Doh or we've used warm plasticine because that gives the same sensation. Treating underlying constipation, as I've spoken about previously, vital that we get that sorted before we start to look at any toileting routines. If we do enter the bathroom and they have smeared the faeces, quickly clean and disinfect the area. Shouting or becoming upset or distressed doesn't always work, and try and encourage your child to be part of that process, recognising that, you know, this isn't appropriate and we've got to clean it up and get rid of it and it's gone, but trying to stay calm. I know that's very easy to say when you walk in, it's a horrible shock, and but trying to stay calm, do not shout or lecture. Okay, so that's just a few tips that we've built up with parents that we've worked with in the past. So my child will only poo in a nappy or pull-up. So remembering the child who asks for a nappy or a pull-up, they've recognised those skills and they know. So those messages have been sent to their brain to tell them that they need to poo. So some of the things we looked at: check for constipation. Is it because they're constipated that they need the protection of the nappy? Changing your child in the toilet or the bathroom when they've used a nappy, like I've spoken about before, taking the nappy off, actually taking it to the toilet and emptying it out. Try and take that anxiety or that fear of actually going and sitting on the toilet. Involving your child in wiping their bottom and emptying the nappy into the toilet again, encouraging your child to sit. We say 15 to 20 minutes after eating, as I've spoken about before, because that's the time when the gastro reflux has worked. And using the blowing exercises, we need them to stay on the toilet for about 5 to 10 minutes if we can, but just as long as what you feel is feasible for your child, and use it as a staged approach that we've spoken about previously. And there's no harm in having to step back if we move on a stage and it doesn't work. Just some tips before we finish the presentation. It's never too late to start. Not every child will give you signs that we need to do this, but just having a go and get it started whenever you feel that you can cope with it and your child's going to be able to cope with it. Be patient. It is hard. It is going to be hard. You know, we're going to have lots of accidents, but just being patient with yourself and with the young person. Buy lots of underwear and expect lots of accidents. Be brave. You'll need lots of determination. It will be very easy to think, let's put the pull-ups back on because I can't deal with this. It's, you know, I can't cope. This isn't working. We're getting nowhere. We've been trying it for a month now. We're no further forward. So just be determined and just, you know, keep going and having it, you know, praise your child when they get it right. Just, like I said to you, just one little step. Bring on the massive praise. You know, one thing is further towards being toilet trained. And if you do need any further support, please contact us. We're here to support you. If you need any further support on the advice, you know, on this number, please do contact us and we will support you as much as what we can. It might just be you need to have a good chat with us. What do we think about this? And we are here. So if you are aiming to toilet train and you come to a point where you think, I can't cope with this bit anymore, we're not getting anywhere, please contact us and we are here to support you. As I said, you can see this is our base. We're based at Harden Health Centre and this is the contact number. On the presentation here is also the ERIC website. I would highly recommend that you have a look at this website. This has got lots of things. It's got a section for professionals, a section for parents, a section for children, and it's definitely worth looking at. It's got lots of stories on there, tips, real life stories from parents who've done the same. So please have a look on there and see if there's anything that could support you with that. That is the end of the presentation. If there is anything that we can support you, then please do contact us on the single point of access. Thank you for listening to our presentation today.